Okay, so guys, good morning once again. And it's Saturday. Guess what? It's been a long time I came on this set. Yeah, it's been long, like months, where I've been sitting down here with Dr. Ba. So, like every Saturday, yes, Dr. Ba, they always stay here to tell you guys everything you need to know about your health. But recently, because of the pandemic, because of, because they affect the entire world, we've been dwelling so very much on coronavirus. And guess what? He came this morning and was giving me the updates. I don't dey sad before because of the outbreak, but then with the updates where he give me this morning, he can't make me dey sadder, if there's a word like that, because the numbers are increasing. You can't be like, say, we don't even they do enough, to curb this pandemic. But then we'll be doing our best, but maybe our best is not just good enough. Maybe we need to intensify and all of that, because the cases are increasing. A place like US, I was just telling me now, say they don't enter almost 16 million, and then South Africa are the third in the world, coming first for Africa. And then Nigeria, they enter third for Africa. I say, if they enter third for something else, I wouldn't have been worried, like something good, but not for something like this. Ladies and gentlemen, obviously it's not Steve that will be doing justice to all of this. The in-house doctor, the expert certified in his field, talking about Dr. Ba. And guess what? He just gave me a pen. I said I was going to thank him. It wasn't Chima that gave me this pen. It was Dr. Ba that gave me Rolex pen.
Thank you very much.
Doctor, good morning, sir.
Yeah, thank you. So pleased to have you
Yeah,
back.
so longest time.
Yeah, thank you very much.
It's good to be here.
Yeah, good morning, viewers at home and around the world. Just like she has given a summary, we'll still be revisiting coronavirus pandemic. Coronavirus pandemic. That will still be our topic for today. I'd like to start by reading out a concern that was raised by WHO Emergency Operations Chief, Dr. Mike Ryan, about Africa. I am concerned right now that we are beginning to see an acceleration of the disease in Africa. And we need to take that very seriously. Ryan told a press briefing from Geneva. Many of those countries exist in the midst of fragility and conflict. South Africa may unfortunately be a precursor, he said. It may be a warning for what will happen in the rest of Africa. Now, why did he single out South Africa? Currently, South Africa is about the worst hit, hardest hit country in the whole of Africa. As a matter of fact, as we speak, South Africa is fifth in the whole world. They are fifth in the whole world. After US, we have Brazil, India, Russia, and of course, South Africa. As of the last 24 hours, South Africa, my sources were Odometer, okay? And then Johns Hopkins statistics, university statistics are about the same, maybe with a little variation. Okay, so globally, the world has seen almost 16 million. Like Slimity rightly pointed that it wasn't the US that saw 16 million, that was almost hitting 16 million. It's actually the global tally. The world is about hitting 16 million infected cases. Precisely 15,945,330 cases have been discovered of infected persons have been discovered in the world. Okay, that's just 54,670 short of 16 million. So, okay, so it's nearly 16 million. Now, among this group of people that have been affected, unfortunately, and sadly too, 642,776 persons have died to this contagion. Also, I'd like to point out that almost about 10 million have equally recovered from COVID-19. Precisely, 9,742,879 persons have recovered from COVID-19. US has been worst hit. At the moment, US has a total of 4,248,327 infected cases. Brazil is next to them, 2,348,000 200 infected individuals. And of course, you have India. India recorded their highest infection toll in the last 24 hours. India saw 49,000 new cases. Russia comes forth with 800,849 infected persons. And of course, here comes our own South Africa, and we are worried. With 421,996 infected individuals. New cases in South Africa was 13,944 over the last 24 hours. New deaths in South Africa over the last 24 hours was 250 persons. And our country, Nigeria, also, Nigeria is seated on the global scale. Nigeria is seated on number 47. Okay? Nigeria is seated at number 47.
In the world?
Yes, in the world. Now, over the last 24 hours, Nigeria recorded 591 new cases. Within these figures, total confirmed cases in Nigeria is almost 40,000. It's now 39,539 of infected persons. 16,559 people have been discharged, treated successfully, and discharged to rejoin the community. And unfortunately, the recorded deaths we have in Nigeria as of today stands at 845. Now, while she was talking, she was wondering, why is it that these figures appear not to be coming down?
At all.
Is it that we are not doing enough?
Yeah.
I would say we are not doing enough. Comparing from where we started, at the moment, Nigeria has done over 250,000 tests. And that is a major landmark. Okay? So Nigeria has done over 250,000 tests. Okay? Now, the figures for Nigeria in total cases in Nigeria, 39,539 persons have been affected in the last 24 hours, 591 new cases, total deaths in Nigeria, 845. Deaths in the last 24 hours, 12 persons. The number of tests we have done so far in Nigeria stands at 256,038. So we have gone beyond the 250,000 mark, and that is hardly enough. It's still a drop in the ocean. Also, I like to point out that at the moment, Nigeria has 59 molecular laboratories scattered across the country that have the capacity, scattered across 30 states. So in the coming weeks to months, we will be able to have testing centers in the whole of Nigeria. Now, coming back to Lagos State, for instance, I also want to point out that the isolation capacity in Lagos State has gone up. At the moment, we have a total of 852 available room spaces. Out of these, only 632 are currently in use. Okay, there are about 2 centers in Lagos that have not started admitting patients. Indo, that has a capacity of 70 beds, haven't started. Okay, the IDH2 that was donated by COCAVID recently, that has a bed capacity of 150 beds, haven't equally started admitting patients. Now, surprisingly too, it is worrisome that a number of people who have tested positive and their status have been communicated to them. For one reason or the other, they are refusing in Lagos now to come into admission, and that is not good enough. Okay? Now, I want to read out what the Honorable Commissioner of Health tweeted on the 23rd of July. About 2,036 #COVID-19 cases have been confirmed in Lagos within the past 2 weeks, but have not been picked up from the community to the isolation center for various reasons, including preference for home treatment and wrong information. So a good number of people prefer to be treated at home at the moment. Why is it possible? Remember, we said a couple of times on this show that almost half of people that may get infected may present with no symptoms. They may be asymptomatic. So that is why it's possible for infected people who may not be feeling any overt symptom to still hang on in their houses. And I also do know that the commission also pointed out that in a couple of days from now, they will bring out the modalities for home care. Now, the home care is going to be for a certain category of people. People who have no symptoms to mild symptoms can afford to be managed at home. Okay. But for people who have severe cases, moderate to severe cases and critical cases, will have to be admitted in those isolation centers. And I also would like to add that the 2 new private hospitals that were recently accredited have equally started admitting patients in Lagos. I'm talking about Pelon Hospital that has 11 beds capacity, as well as Vedic Hospital that has 24 bed capacity. Also, First Consultant that previously had 5 bed capacity has increased it to 15. Okay, so the private hospitals are also part of the treatment, so that if you cannot access treatment in any of the government centers, you have an opportunity. And at the moment, the best spaces are said not to be fully occupied. It will also be nice for us to give the distribution of confirmed cases by local government area in Lagos State. At the moment, almost all the local governments in Lagos State have been affected in one way or the other, but Etiosa local government has the highest number of confirmed cases in Lagos State. Okay, followed by Alimosho, Koshofe, Ikeja, and Oshodi. As a matter of fact, yes, these few local governments are said to account for about 60% of all the infected cases in Lagos. Now, if we look at the number of infected cases in Lagos State, at the moment, as of today, 14,177 people are said to have been affected in Lagos. Now, these 14,177 people include those that have been discharged, include also those that have died. Now, when you take out people who have been discharged, who have recovered and been discharged, people who have been transferred and people who have died, you have active cases that are in Lagos. Now, majority of these active cases are still not in isolation center. A good number of them have recovered in the community. I must also point that out. So what that means is that we have a number of people, a large chunk of people, their numbers, of course, are in thousands, that have been infected and they know their status. But for one reason or the other, they are not receiving treatment. And some of them are still interfacing and interacting with you and I on the streets of Lagos. And a good number of them, sadly too, may not be complying with the government directives. A good number of them may not be wearing the face mask that we have been told to do once we are in public space. So today you know that these statistics that have been read out to us reinforces the need for all of us to be fully compliant with government guidelines. Talking about the infection prevention control guidelines, okay, that we've talked about, we must always remember that we must always wash our hands under running water for at least 20 seconds. We must ensure that we do social distancing anytime we are within or we're in a public space, okay? And above all, we must ensure that we wear our face mask and disinfect surfaces, frequently touched surfaces in and around our houses, in our offices, doorknobs, like you rightly said, car knobs, door handles, railings in buildings and offices. Now, it behoves on all of us as individuals to start taking responsibility. Okay. It boils down to us taking responsibilities.
All right, Doctor, please let me just hold you up here so that we can quickly go for our break, so that if you come back, obviously we'll straight up open the phone line. So if you get questions, you got contributions to make, you have the opportunity to call us on the show. Stick around, guys. Dr. Bat and myself, we will come back. Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit interact with us on top the show or talk to the doctor through we phone numbers wey be 08173147589 and 08105434984. You still fit call us on top we Skype ID wey be WAP TV. You fit also advertise your product and services on top we show where they help people. Terms and conditions apply, shall.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
I wanted to ask about the New York Times report previewing an open letter to be published by 239 scientists from around the world calling for the WHO to give greater acknowledgement to the risk of an airborne spread of COVID-19. First of all, I wanted to get your reaction to those reports and to see where WHO's research stands in terms of where we are.
Thank you for your question. So we have discussed and collaborated with many of the signatories of the articles that you have mentioned over the last few months. And indeed, we discussed the available evidence that has been discussed in these pieces. And also, we received contributions from many of the signatories of these pieces. We acknowledge that there is emerging evidence in this field, as in all other fields, regarding the COVID-19 virus and pandemic. And therefore, we believe that we have to be open to this evidence and understand its implications regarding the modes of transmission and also regarding the precautions that need to be taken.
Thank you, Benedetta. Just to say that, yes, we have been engaged with this group since April, when they first wrote to us on April 1st. And we've had an active engagement with them and with many of the signatories on this through different networks. And as we have said previously, we welcome the interaction from scientists all over the world, from many different disciplines. Many of the signatories are engineers, which is a wonderful area of expertise, which adds to growing knowledge about the importance of ventilation, which we feel also is very important. We have been talking about the possibility of airborne transmission and aerosol transmission as one of the modes of transmission of COVID-19, as well as droplet. We've looked at fomites, we look at fecal oral, we look at mother to child, we look at animal to human, of course, as well. And so we are producing a scientific brief on summarizing where we are. We've been working on this for several weeks now. And we've engaged with a large number of groups, epidemiologists and clinicians, IPC specialists, engineers, mathematical modelers, to try to consolidate the growing knowledge around transmission. But we have spoken about the importance of all of the different potential modes of transmission. This is a respiratory pathogen, and so it is important that what we know fits into the guidance that we have, which is why a comprehensive package of interventions are required to be able to stop transmission. This includes not only physical distancing, it includes the use of masks where appropriate in certain settings, specifically where you can't do physical distancing, and especially for healthcare workers. So our focus on the use of masks, of course, is for healthcare workers, and to use airborne precautions where you have those aerosol generating procedures. But we're also looking at the possible role of airborne transmission in other settings where you have particularly closed settings where you have poor ventilation. So we will be issuing our brief in the coming days, and that will outline everything that we have in this area.
Hello. Today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community, and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19. Trust me, we don't mind going that long for as long as you get to learn, and of course understand waiting Dr. Bat, waiting the word in general. They talk about, let me say kudos to every of our health practitioners, from Dr. Bat to the nurses. You guys are super amazing, because now be the frontline workers. Now they face these people. You get to see cases, you get to see, treat them every day, and I can just imagine the stress they go through. Kudos again to Dr. Bat for making these videos.
Thank you very much.
Available for us, for you guys also. So guys, please call the numbers on your screen: 08105434984 and 08173147589. Please feel free to add us up on Skype. Yes, you can see our Skype ID at WAP TV, and of course we'll get to see your beautiful and handsome faces. Also add us up on Instagram at WAP TV channel. We'll take your messages and of course entertain your calls this morning. Now, Dr. Bat, most starts waiting the schedule for the past 24 hours. I think what we're used to now, the fact that Lagos, they always carry or get the highest number. As it is, I'm sure overall we have the highest number of cases. But then I found out that Oyo within the past 24 hours. Then they actually lead. I think they had, from the figures they gave us, they had 190 compared to that of Lagos. I don't know. And
Yes.
from the info they get also, I guess activities don't resume back full time. So is that responsible for the increase they had?
Yes, it's not just in Oyo State, but precisely, let me go back to the figures you alluded to.
Okay.
Over the night, Nigeria recorded 591 new cases of infected individuals. Oyo State came top with 191 persons.
So even 191.
191 people were infected in Oyo State, according to NCDC statistics. Lagos came second with 168 individuals. FCT came third. Also, I'd like to look at the tally, the country's tally so far. So far, Lagos State is number one with 14,177 people or cases. FCT is second with 3,437 cases, and Oyo State is third with 2,497 cases. We have
so
Chinedu from Rivers
Chinedu.
State.
Hello, good morning.
Good morning. Good to have you again.
Thank you.
Okay, so you get questions or contributions to make?
To your guests in the studio.
Thank you very much.
So have you got questions?
You're doing a very good job.
Thank you.
Thank you very much.
Thank you.
We appreciate you.
Thank you, Doc. My questions, I just watched the video on how to make use of
The
a
face
mask.
mask.
And I've just been wondering, all this process is, like, do you know how many times that woman washed her, had to use the sanitizer? Before you put it, you have to use the sanitizer, then you don't have to touch the mask, and then, Doc, those things, are they practicable? Like,
Are they realistic?
do you practice it now? I'm asking the Doc a personal question, because that thing looks like something that was acted. It's like a drama to me. But this is something we wear every day, and I wonder how practicable are these things.
Okay.
And how practicable are they? And secondly, you told us that South Africa is the fifth, I guess.
Yes, they're third in the world.
Fifth in the world.
Fifth in the world, rather, but they
Yes.
are
Right?
First in Africa.
First in Africa now.
Okay. And Nigeria has opened, I don't know, Nigeria has opened its borders, right?
Yes, we have. In some places, at least within across the
Nigeria
states,
now,
within
then.
Nigeria, across
That states.
the states, from one state to the other.
Within this, okay, but externally
Yes,
the
no,
borders
I
are
don't think we
closed.
have done that.
Okay, because you know that most young boys now, the easiest place to go now is South Africa. So I would want us not to reopen the borders, but particularly, Doc, please, can you help us with this mask of a thing? How practicable is this thing? Thank you.
Thank
All
you
right.
very much. Thank you very much. That's a practical question. And I must be very sincere and honest with you. Now, if you look at Oyo State, for instance, she asked me a question on Oyo State, why the resurgence, particularly with respect to Oyo State. Now, I do know that Oyo State has actually opened up worship centers. They've opened up schools. Okay, so all these events that can bring about gathering, okay, mass gathering, no matter how little you think they may be, have shown, it's not just in Nigeria, not just in Oyo State, even on a global scale. South Africa is making plans. By 27th of this month, they will be shutting down the schools again for another 4 weeks. India too, that opened some of their centers too quickly. Okay, if you ask me, that they are paying the price. Not just India, okay, US, the same thing is happening. So on a global scale, it has been shown that people that opened such centers too quickly are beginning to go back with some of these challenges, and some are shutting down again. So we should be careful. We need to take our time so that we can get it right. Now, coming to the question you ask about mask, it is true that it is not palatable to have this mask on. especially people who probably drive in the scorching sun of the day, drive tricycle, drive vehicles that do not have a conditioner. I can imagine the challenges that they will be facing. But when you look at it from the point of view that is actually a matter of life and death, you need to sit up. You need to tell yourself the simple truth that it's better to sweat and be drenched in one sweat and hang on to life than to get infected, especially for people who may have pre-existing comorbidities, especially for the elderly. Now that these things have opened up, we have a number of infographics that will be shown to us. A good number of them are to encourage us to take measures to prevent ourselves from getting infected. Now, coming to your question, whether I do as a person, I religiously use my face mask.
You only joke with it, trust me.
I don't joke with it. Now, in my facility too, in my hospital, we have a number of measures put in place. In the seats, we have a sitting arrangement that will put posters in some places. Do not sit here. Do not sit here. To enable people know what to do. And as you're coming in, you're washing your hand. If you don't wash your hand, we can't allow you to enter. You may want to decide, you may choose to wash your hand, at the same time choose to use sanitizer, is all for you. But in places where you cannot,
Danjuma. Morning.
Good morning.
Okay, please go on.
Please, what I want to ask.
Yeah?
Yeah.
Turn down your volume.
Yeah, I'm calling for Kogi State.
Yeah, no.
So please, so how can you present this? Okay, I say how can you present this? So this COVID-19, how can you present it? Because some people are not using masks, and some people don't have money to buy commodities masks. I don't know.
He was actually on that before you called, so just listen up. He will tell you can.
Yes, so we're talking about the measures that can be put in place, things that you can do, that we can do as individuals. One of them is one we're dealing with shortly: the wearing of face mask. You have to make it compulsory. To ensure that you not just you alone in your house. You must ensure that everybody that is in that house, that is in and around you, be it in the office or elsewhere, you must ensure and encourage such people to go with their face masks anytime they are in the public places. Okay? Now, it's important, not just public places. If you're in supermarkets, if you're in church or other places, now that we're beginning to open up places, we have this on our screen at the moment. That was a son that probably traveled to the village to go and see the parents. And you can see he was carrying a gift. And the father disregarded whatever gift he was carrying home and was pointing to him that his face mask was not properly worn, that he should have ideally be traveling at this time. Because if you infect old people, they are more vulnerable. They can die off, even while the younger people that may have infected them may survive from the disease. So it's important to take these measures very seriously. Okay? So some of the measures that we need to take, like we have enumerated before, I will repeat them again just because of our caller that asked a while ago. Okay? Now, for the face mask, before you start putting on the face mask, you need to wash your hands.
Let's take Tunde, doctor. Hello, Tunde, good morning.
Hello, good morning.
Good morning, sir.
Your program has been highly educative.
Thank you,
sir.
And we are really getting a lot from it.
Thank you,
sir.
Or if I should divert a little bit, I want to ask a question. This close church or whatever. What about the parent that goes to all these congested markets, where by the time they comes down home, are they not going to infect the children at home? I think we should critically look at that angle.
Okay, and just to add more to what you said, doctor. Now, I've observed that when you go to the market, you see them on their mask and all of that. But most of them still fail to social distance themselves. It's still clustered up. So now, is it that you can choose to do one, you can choose to wear your mask and then you still gather, or because really, I don't know. You see them with the mask, but then you still see them touching, hugging themselves. So what's the use of me wearing the mask if I still have to touch your body?
Thank you very much. But first, let me take his question.
Yes,
now, I think the reason why our leaders in their wisdom decided to open the market first ahead of worship centers is basically because people are faced with challenges of making out making out a living and getting protected. So you need to balance the equation. The equation is between staying alive and staying safe. Okay? So in as much as we want people to be protected, we still want them to be able to go and seek for their sources of livelihood. If you keep people at home without food, without palliatives, you're encouraging chaos. Okay? They are not likely to listen to you. Okay, so to balance the equation, I want to believe that government did that to balance the equation so that people will be able to meet up with their daily challenges. Okay, that's what now, for worship centers, you have an option. You may choose to go online. A number of them are being done online. You may choose to go online and worship with your worship center wherever they are located. You may choose not to be physically present in those places. But market, you need to go there and get your daily food. What you will eat, okay? What you need to keep yourself alive. So it has to do with people's sources of livelihood. Okay, so that equation has to be balanced. Otherwise, you will end up creating chaos. Because when we imposed that lockdown for several weeks, a lot of people didn't find it funny. It wasn't easy. So it's difficult to actually shut down a place. But in spite of all of this, we have to strike a balance. Okay, so back to some of the measures that we need to take. Now, the social distancing you talked about, you need to incorporate all of them together. You don't do one in isolation to the other. You need to wear your face mask. You need to maintain social distance. Now, the reason is, even with the best of face masks, you can still get infected, and you will still be able to infect other people around you should you be infected. And this brings us to the fact that sometimes we do temperature checks in some places. Let me also point it out at this show that those temperature checks and some other things we are doing can only pick out less than 20% of the infected people. A large chunk of people who are infected, over 80%, will not show any symptoms. So they won't show you fever. So they can easily enter places where you're using your temperature, where you're using your thermometer to check for temperature and some other things. So we have people in the community that are infected, but they are not showing any symptoms. And again, coupled with the fact that, apart from the fact that we have people who are infected and not showing symptoms, WHO has come out to acknowledge that this disease is airborne. Is airborne, okay? So you may have a situation where you can sneeze and cough in a lift, and few minutes after you've left, an innocent person will probably step into such a lift and thinking he may be the only one. He may feel free to take off the mask for some time. And of course, once he inhales those hanging particles in the air, he could get infected. Okay, so let's talk about the asymptomatic transmission, the pre-symptomatic transmission, and as well as the symptomatic transmission. Asymptomatic, people who do not have any symptoms, they appear normal, but yet they could be infected and can infect people. Pre-symptomatic are people who may be infected, but few days after they've caught the infection, they may not show any symptoms. Okay, say for 3 to 5 days. Subsequently, they may start manifesting symptoms. So this group of individuals are called pre-symptomatic carriers. And then for symptomatic carriers are people that will show overt symptoms. Okay, few days after they're infected, they will manifest all sorts of symptoms. And what are these symptoms? The major symptoms we've been told before. Number 1 is dry cough. Number 2 is fever. Number 3 is shortness of breath or difficulty in breathing, if you like. Now, the other additional new symptoms that can easily give out a COVID case. When someone has a sudden loss of sense of taste or sense of smell, you should be worried, okay? If you have such symptoms, the government has told us that what to do is not to go to your regular hospitals. That what you can do is to call some set of lines, okay, state hotlines. And when you make such calls, you'll be instructed what to do, okay? Yeah, those are the set of symptoms that one may have. Okay, apart from this one, there are other symptoms too that are not considered to be major symptoms. As a matter of fact, I read an article that said that COVID-19 can equally present with skin rash, that 1 out of every 11 people that may have such skin rash may be an indication that the person may be having COVID-19. So apart from the skin rash, you could have diarrhea, okay? You could have some other symptoms like sore throat, okay? But we have these symptoms listed out. We have listed out in a number of platforms that if you have this set of symptoms, you should reach out to your state hotline. And I am also happy now that we have been given an option of getting tested. So is either you go to get tested in a government center, that is if your symptoms fall within the what they refer to as a set of symptoms that when you have, government will consider you qualified for test. Okay. Now, but in a situation where you choose to do the test on your own, for some reasons, maybe your office has required that everybody that is returning to work must have that such a test done. Okay, you can go to the private labs. There are about 7 of them in Lagos, and you have them in some other states as well. You can go there and get tested. And also, government has also pegged the prices for testing in this private lab in order to enable people to have the ability to afford these tests. But even at that, that's still way too expensive. Okay?
Dr. Bami, I wanted to even know, because I think compared to what we have in other countries in terms of numbers they get for their tests, what is responsible? I think ours is a bit low, and we get people coming down with symptoms like on a daily. So is it that we do not have enough laboratories, or people don't really come out to get tested?
No. Now, my view about that is the fact that it's not that we do not have enough laboratories. At the moment, what we had at the beginning cannot be compared with what we have now. We have 59 molecular laboratories scattered across 30 states of the Federation. At the beginning, when this virus hit our shores, when it came to Nigeria, we had just only 5. And then we have fewer capacities to actually test for some of those things. But all of that have changed now, okay? Additionally, people now have an option, okay? Not that I want a place I can go and get tested regardless of whether I'm having symptoms or not. You can have that done, but then you have to pay. But however, if you have some set of symptoms and you fall within the guidelines that the states, that ACDC have put out, you can be tested in government centers without paying anything. Really? I need to point that out, okay? Because over the week, we had a number of comments concerning the cost of treatment and all that, but I'm happy Lagos State government has actually come out to clear the air on that as well.
Okay, I think it's safe for us to continue from this next week, Saturday, all things being equal. So I want to say a big thank you to everybody who've been joining us on the show this morning. Yes, for all of Dr. Bat's episode talking about Health Matta when I don't miss, feel free to go watch that on YouTube. Thank you so very much, Doctor.
See you next week.
See you next week.
Thank you too.